start the and it's my pleasure to welcome two experts from the City of Chicago Department of Family and Support Services Senior Services Division to tell us about the various citywide programs that help address the diverse needs and interests of older Chicagoans. With us today are Karen Kolb, and she is the manager of the Family and Support Services in Chicago's Area Agency on Aging and the Senior Services Division of the Department of Family and Support Services. In that role, she administers a broad portfolio of in-home support programs for Chicago's older adults that include home delivered and congregate meals, caregiver support, and legal services, and a variety of other programs. Karen holds a Master of Science in Human Development and Family Studies, and she's a registered financial gerontologist. And also we have the pleasure of hearing from Stacy Subita. She is a supervisor of family and support services for the caregiver portfolio in the Senior Services Division of DFSS. And this portfolio includes the caregiver counseling and support services, caregiving respite, grandparents and older relatives raising children, and Chore Services programs. Stacy holds a Master's of Social Work Gerontology concentration from Washington University in St. Louis. She's a licensed clinical social worker with over 15 years of experience in working with adults in the Aging Network. So it's my pleasure to welcome both of you to Chicago Hyde Park Village Drop-In today. And with that, feel free to start sharing your screen and telling us about all the wonderful things you do for seniors.
Great. Can you all see my screen now?
Yes.
Okay, great.
Could you mute all of us? Because
Yes,
somebody's got a radio on.
I know, I'm going to do that. I'm going to mute you one at a time so I don't mute the speakers.
Okay.
Hi, everyone. Can you hear me okay? Maybe wave your hand if everything's all right.
No, you're fine.
All right, great. Well, welcome. Thanks for having us today. I know Stacy and I are delighted to be here. And I'm really pleased to meet your new executive director. That's very exciting. And it's just, you all have been at it for quite a while, and it's really exciting to see the impact that you continue to have. So Stacy and I are glad to be here. We're really pleased to talk about the services that are available to support older adults within our programming. We'll have some time for questions at the end. So we're going to specifically go over what we do within what's called the Area Agency on Aging and the services that we offer. And we'll talk a bit about those. And then please feel free to put your questions in the chat if you want to just kind of get them off your mind and put them to the side. And then otherwise we'll have time at the end. Okay, great. And Stacy, remind me how much time we have.
I think we have the hour.
Okay, good.
Yeah.
And we've both been introduced, so we'll just go ahead and jump right into the presentation. So here's some information about the Department of Family and Support Services. And we are from children all the way to later life, lifespan agency. And as you can see here, these are our missions. This is our mission and our priorities. And we really work to connect Chicago residents and families with resources that build their stability, support their well-being, and empower them to thrive. And if you want to go to the next slide, Stacy. As I said, we are lifespan. Oh, we're one of the largest social service funders in Chicago and the 5th largest city agency. We have 6 community service centers, which you may be familiar with, and 6 regional senior centers. So the Atlas Senior Center is probably the closest regional center to you all. And these locations, people can be assessed and they can receive in-person assistance and of course attend the wide variety of programming that is available at those. So we have over 360 community-based organizations or delegate agencies that we fund, and we issue over 1,600 contracts annually. We also annually serve over 400,000 of Chicago's most vulnerable individuals. And we have an annual budget of over 425 million. And as I said previously, we are a lifespan organization. So you can see the broad variety of programs that we do here. We have children's services and youth services. We have homeless services, the Division on Domestic Violence, human services, workforce services, and then of course we have senior services, and that is the focus of what we'll be talking about today. And so we're what's called an area agency on aging, and just kind of a quick 101. Of course, the Older Americans Act in 1965 funded our federal programs to older people and to older Americans or older residents who live in our country. And in general, that's identified as being 60 and older. And what happens is that money is, of course, given by Congress. And then it goes out to the states to state units on aging. So in Illinois, that's the Illinois Department on Aging. And then what happens is it goes down to what's called an area agency on aging in most states. There's about 7 states that don't have area agencies on aging. But in the state of Illinois, we have what is called a planning service area or area agency on aging. And we have 13 of those statewide. And Chicago is one of about 8 cities across the nation where the city government administers the programs for aging. So you can think about our peer cities like Atlanta, Los Angeles, New York, Seattle. They have kind of similar services. And of course, our services are guided by our federal guidelines and are for not just individuals over 60 years of age in most cases, but also their caregivers. And so we offer services through senior centers, and you may have been to some of our senior centers throughout the city through, of course, nutritious meals, caregiver supports, programming to address social isolation and cognitive impairments. We have WellBeing Checks on older people across the city. And even further, we have case advocacy and support for those individuals who may be at risk in the community. And we also have the Ombudsman Program, which represents people who are 19 and over. The preponderance of people, of course, are older adults who live in residential care settings and much more. So as I've said, I think 3 times now, we are what's called an area agency on aging, and we're one of 13 AAAs across across Illinois. And to that end, we advocate, plan, coordinate, and fund services for older adults. And we serve all Chicagoans, and we do have emphasis on those with the greatest economic need, people who live alone, or those who are at risk of institutionalization. And we have 3 broad goals as an area agency on aging. We want to support people living independently in the community of their choice as long as possible. We want to ensure that individuals who reside in residential facilities are treated with dignity and care, and also continue to guarantee that, like the rest of our lives, particularly that older adults have access to accurate information so they can participate in public policy. So you'll see here that we have 21 senior centers, 49 congregate dining locations. We have an I&A center where people can call or go to get support. We offer services in-home to help people remain living in the community and have volunteer and social isolation programs. So those are programs that are geared to keep you connected either while you're at home or to assist you with volunteering. And you'll see this number on the bottom a number of times throughout our presentation today. You can call 311 to get connected to services, or you can always call our information and assistance line directly. And that number is 312-888-8255. 744-4016. And you can also email us. And keep in mind that you can call not just for yourself, you can call for a neighbor you may have concerns about. You could call for a loved one, and certainly for yourself. Stacy, I think you want to go ahead and go from here.
Sure. So going into our senior centers, so these are the community focal points for socialization, meals, recreation, fitness, wellness activities, and education. As we mentioned, there's 21 senior centers located throughout the city. We have 6 regional senior centers. And as Karen mentioned, I believe the Atlas Center is probably the closest to where you're located, as well as 15 satellite centers. All of the sites are open from 8:30 to 4:30, and they have congregate dining options as well as to-go lunches for pickup between 10:30 a.m. and 1 p.m. As the city is continuing to open back up, we're currently welcoming seniors back as we resume and expand some of the activities at the senior centers. In fiscal year 21, the to-go meals, we served over 475,000. So during the pandemic, as dining was limited, most of our participation at the senior centers were through this to-go meal option. So we also have the congregate dining, which is also called Golden Diners. Some of our Golden Diner sites are located at the senior center, so it's offered at 20 of our senior centers. And then we also have 29 other community nutrition sites. So some are located, for example, in CHA housing. We also have some community sites, located through the city. And our congregate dining is really intended to help address isolation and nutrition barriers. We also offer diverse meals. So with our congregate dining, there's also Chinese, Korean, Vietnamese, and South Asian meals as well. And as we mentioned, it's from 10:30 to 12:30 weekdays that we offer the congregate dining. There is a $2 suggested donation, but if that doesn't prevent someone from participating if they're not able to donate that. As Karen mentioned, we do have the information and assistance line. So this is sort of our one-stop shop for any of the services that we are mentioning on our slides here. So really the 3 main things that our information and assistance staff or INA team does, one of which is benefits access applications. So this includes transportation assistance. And so through benefits access, it offers the license plate discounts for older adults and individuals with disabilities, as well as the free or reduced bus passes. In fiscal year 21, we assisted over 7,200 older adults and individuals with disabilities with these transportation applications. In addition, they also provide the referrals and enrollment for, again, the programs that we mentioned in these slides. So these include assessments for community programs such as the Community Care Program, in-home supports, home delivered meals, our Chore Supports, which we'll talk about a little bit later, things like adult day services, the automated medication dispensers and emergency home response, as well as screening for eligibility for nursing home placements. And then the final piece that they do in addition to the referrals and the benefits access is assisting with the Senior Health Assistance Program to enroll in programs such as Medicare. During open enrollment, they help select Part D prescription drug plans. And nearly 2,000 seniors were helped to enroll in Medicare and the Extra Help Low Income Savings Program and other benefits. Physically, the INA team is located at room 100 of City Hall. So they do accept, walk-ins. But again, you can always contact our information and assistance line at the number listed here. You can call 311. And then we are open from 8:30 to 4:30 on weekdays. In addition to the 311 phone number, there's also the 311 website, and you can also make requests there directly, or you can email us at aging@cityofchicago.org.
Stacy, before we go on, pardon me, maybe we should just tell people what the community care program is.
Sure. So the community care program is actually a state-funded program. And so there are community agencies called care coordination units. And so it's really intended, again, with the same goal of allowing folks to remain independent with supports at home. So they offer things like homemakers. You see the adult day services here, the emergency home response. There are eligibility limitations. I believe the assets, you have to be under 17,500 in assets to qualify. But you would get an assessment from the care coordinator, and then they can connect you with these services. And so if that, again, is something that you would be interested for someone you know or for yourself, you can contact our INA line and they will get you connected.
And Stacy, I might just add, so I remember when I was young and my grandparents were getting older, and they were in New Orleans, Louisiana, and Louisiana was only second to Mississippi as kind of the worst place to grow older. And you would either have services, you lived at home and you were independent, or you lived in a nursing home. And so that people overwhelmingly don't want two choices. And so this plan, the community care program, is part of a nationwide movement to help people to remain in the setting of their choice and to manage their finances to do so. Pardon me. So though there are income limitations, there's also cost sharing programs, and there's a phased approach. Your home or condo or apartment is an eligible asset, so that wouldn't be counted. And so it's a way for people to preserve their home asset and stay at home while they receive services to support them to do so. So sorry for that lengthy description. I just think it's really important for people to know that there's so many options to help, and that really our role is to help to navigate those. Thanks.
And then with the community care, with the care coordination units, they also do the assessments for the home delivered meal program. Now, this does not have any income or asset requirements. And so, again, for eligibility, it's just for older Chicagoans that are 60 years of age or older to qualify. And so with home delivered meals, we provide nutritious meals. There's options for hot, cold, and frozen. And you receive 2 meals a day, 5 days a week. We've provided over 5 million home delivered meals, including the 475,000 to-go meals, which we mentioned earlier, to over 25,000 clients in fiscal year 2021. Also with the home delivered meals, there's a delivery of shelf-stable meals that are distributed quarterly in case of inclement weather or other emergencies. So over 350,000 shelf-stable meals were delivered in 2021. And again, to refer to this program, you can contact information and assistance. Okay. So now we're going to go into some of the programs that I work with directly. So these are services for caregivers and grandparents or older relatives raising children. And so we work with our delegate agencies to provide a number of services. So that includes individual and family counseling for caregivers, group therapy or support groups, training and education. And so topics like self-care, legal assistance, we've been able to bring in, different speakers to help on this topic. And gap filling services to purchase goods and services. And so again, the gap filling is for caregivers and grandparents. And so, it can help fill the need if there's items that, maybe insurance doesn't cover. So, we've seen insure, walkers, incontinence supplies that we purchase. And there are things that we purchase also for the children. And so school supplies, clothing, furniture, and so, they can avail of the gap filling to help cover that need. We also offer respite care. Now this is just for the caregiver program only, not for the grandparents program, but it offers in-home care or a temporary stay in a skilled nursing or supportive living facility. And so we have trained professionals that can help provide a break for a caregiver, by helping care for that loved one temporarily. So to be eligible, this is geared more towards family or informal caregivers, not necessarily paid caregivers, who are providing care to Chicagoans 60 years of age or older. We also serve individuals under 60 if they do have Alzheimer's disease or related dementias. And then for our grandparents program, it's actually a lower age limit. It's 55 years of age or older. So this would be if they have the primary responsibility for raising the child under 18 or a person with severe disabilities 19 to 59. And so for the children, there would be the parental support is not in the picture. And so it's the grandparents that are providing the care. I mentioned earlier our Chore Services. So this is an in-home support that we offer. There's two different types of chore services. We have our short-term and heavy-duty chore. Short-term assists for temporary assistance for clients that might be recovering from maybe a hospitalization or illness. And our staff with our delegate agencies help with household tasks like cleaning, laundry, meal preparation, things like that. And then our heavy duty chore services involves more kind of intensive and extensive cleaning for clients that may be living in conditions that can impact their health or safety. And so they help with removal of trash, washing floors, walls, assistance with packing if someone's moving, disposal of items. And again, the eligibility is for individuals 60 and over who are Chicago residents that may need temporary assistance with these activities. That being said, as we mentioned earlier, we're an area agency on aging. And so if you do find individuals that live outside of Chicago that might be in need of some of the services we mentioned, we can certainly connect you to the area agencies in those areas as well throughout the state. Okay, so this is our Savvy Caregiver and Apartment Manager training, which is run by my colleague, Dr. Victoria Russo. So she offers a free interactive 6-week training to help family caregivers who may be providing care for a loved one or a friend with Alzheimer's disease or related dementias. This training specifically helps develop skills to help with a caregiving situation, reduce stress, plan for self-care, and learn how to effectively communicate with a person living with dementia. We do have the link here, which we can send out to you. And so there's several sessions that are offered. I know in the spring, there's a couple ones that are going to be starting soon. So we can get those dates to you if you're interested. And then she also works, oh, I'm sorry. Yes.
Sorry, Stacey. I just want to say the apartment manager training. I know you all have some kind of mid-level buildings in around your Chicago Hyde Park Village area. And if you know a management company or someone that you think should take this apartment training, you can always contact us or contact Victoria there to let her know, because part of what they do is train people about, hey, this is how you help folks that are growing older. And sometimes we've noticed from some of the inquiries that we get that condo boards don't know how to navigate some of the things that are happening as people grow older. They don't know some of the supports that are available. And also they might not be aware of all of the legal supports that are available for people as they grow older. And so just please, keep that in mind, because it's a really good training. Thanks,
Absolutely.
Stacey.
Yep, no problem. Yeah, and so she does this in partnership with UIC and Northwestern University. And they've also tried to, it's an online learning module that's available as well. So they've shifted kind of from the live training to this online module. So really it helps apartment managers recognize symptoms and make referrals to services that might be necessary for the residents in their building. So again, please feel free to contact Victoria or Danielle, who also works with the program. Their numbers are listed on the slides. Okay. And then dementia friendly. We all know that you all are the pioneers in Illinois to create this dementia friendly or join the dementia friendly movement. And so DFSS, has been attending some of the meetings with the Illinois Cognitive Resources Network, and learning about what you all are doing in your communities as well. So, DFSS wants to be a support to that. And so if any of these services, might help in that initiative, we're happy to be a resource. You all know that Dementia Friendly Illinois is really about working with individuals living with dementia and their support systems. As we now know, I think there's 21 communities throughout Illinois that have the dementia friendly status. And so, again, we're here as a support, with this initiative, and thank you, Hyde Park, for kind of kicking the state off with the work that you've done with this. So we appreciate that. Okay, I'm going to hand it over back to Karen to talk about some of our well-being checks and advocacy support programs.
All right. So these programs are funded locally. This is funded by the city of Chicago, and these are some of our really important programs to keep people living independently, to help people who may be going through transitions, whether it's health transitions or whether it's the death of a loved one or a shift in housing. These are really important programs, and we really will rely on people from the community to provide information to us for, in particular, so case advocacy and support, which that really doesn't mean anything to you, but these are our senior well-being checks. And what happens is we get calls about folks, or, I haven't seen my neighbor in 2 weeks. I'm worried about them. The mail's piling up outside. Or sometimes we get calls from the fire department who might go on a, if someone has a fall and they come to the house and they might have concerns. We get inquiries from aldermen, we get inquiries from businesses. Just really, we want to have a community of caring, and one that when folks need help, they're connected to it. So again, you could call INA, you could call 311, you could say, I'd like to ask for a senior well-being check. And that's for people age 55 and better. So we did move the age eligibility for this lower, actually, from 60, because we really want to reach people earlier in their life before they get to be 93 and just living in a lot of challenges. And so really, I think that doing it 55 and better, we've learned a lot. And what happens is when you ask for a senior well-being check, we have a contract with the Salvation Army, and they have a group of people who are experts in aging, and they go out and do an actual check physically at someone's house. They will talk to them face to face. They will find out what supports they have, what challenges they're experiencing, and really just give an opportunity to connect you to services one-on-one. So we're bringing the services to you. And so, for example, if, sometimes people's partners or spouses or siblings who they live with may die, and they might not know how to cook. And so they're running out of food and they can't get to the grocery store on their own. So they would call, or we would get referred to that individual, and we would help to connect you to programs that can support you in that way. And one thing I don't know if we've said, and forgive me for not saying this at the beginning, all of these programs are free. These are all free programs. There is no charge for any of these programs. Some of them, like meals, you can make a donation if you like. You do not have to. These are for all people that reside in our country who are age 60 and better, or 55 in some instances. So please take advantage of them. And just to let you know, in 2021, we did over 1,000 senior well-being checks citywide. And, we on the weekends when it gets cold, and I can tell you it was 6 weekends in a row from January to February, we have teams that meet on the weekends during the day, a couple times a day. We look at all of those calls that are coming in, If people don't have power, if people don't have water, if people don't have food, we have teams that go out to support them. And so really, we are trying to catch people that are at risk and support them. So sometimes they go for the visit and the person says, yeah, I haven't seen my neighbor in 3 weeks. I've been in Florida, or I've been sick, or my dog is sick. It's fine for folks to go out and there's not an issue. So don't feel like someone has to be in very, very dire straits for you to call. So sometimes our senior wellbeing check team goes out and they see someone who's really struggling to remain living independently. And so we have a program called Intensive Case Advocacy Support. And what that program does is what we would call care management, where they can work with someone sometimes for a few months, sometimes for up to a year, to help to navigate some intensive supports that are needed. So, for example, if someone is preparing, maybe they just moved to Chicago to be closer to their family and they need assistance getting connected to the community. Maybe they need assistance locating physicians. Maybe they need assistance locating services to help them in their home. Maybe they just need to know where the senior centers are and what kind of wonderful resources like Chicago Hyde Park Village are available to them. What we do is we train. We have 4 citywide agencies. We have the region, the city is divided into regions, and they're kind of the aging experts within their region. They'll work with people. They will identify together. These are the things that are important to me. This is what I want to work on. You know, they could go to someone's house and say, this person really needs assistance decluttering because their landlord said they're at risk of getting evicted, or the fire department said we can't walk in here. Like, that is the most important thing. But if the person who's there, the most important thing to them is that they can get their dog to the vet, we're going to start with the things that are most important to the individual. Okay. So we'll create what's called a care plan, which is where we would agree to work on things together. And then we help to connect to services. And I say we, I mean our delegate agencies. But really, it is designed to be wraparound services to help to support people to remain living in the community that they choose as long as possible. And I see there's a comment about homeless individuals in the community. And so let's keep that to the end. Thank you for putting that in there, Catherine. This is definitely something good to talk to. And Ellie, I also see you'll ask if the slides are available for download. We are very happy to share them. And also you'll have this recording available. So let's see, I think we're done with this slide. And it continues. Okay, the Ombudsman Program, you all may have heard about this program. And let me just say also, we haven't talked about volunteers, but there is opportunity to volunteer in all of these programs. And we always welcome volunteers now that COVID, hopefully, knock on wood, is declining somewhat. There will be opportunities for people to volunteer, but you can volunteer remotely. You can volunteer at our senior centers. You can volunteer by talking to people on the phone. We have trainings, all of those things you can do. The Ombudsman Program is a formally staffed program. We the individuals who are the ombudsman, and we have 8 of them right now. They are charged with going into residential care facilities. So you may think of skilled nursing facilities or nursing homes, as they were previously called, assisted living, residential care communities, mental health communities, ventilator communities, like places where people go when they need nursing care 24 hours a day. You could have been in a bicycling accident and 20 years old and be on a ventilator, and you would be represented in the same way that someone that is 97 years old and has a cognitive impairment and needs nursing care 24 hours a day. They are all represented by the Ombudsman Program. And their job is to protect, defend, to advocate for the rights of residents that live in these facilities. They also answer a lot of questions from the community about I'm thinking about, I need some help, or I'm going to go through rehab and have my hip operated on. What are good facilities I can go to? You know, my sister needs to move. Any of those things you can call and get information and assistance. And then really, it's important to remember that even though this is housed within our area agency on aging, that is a lifespan program, so 19 and older. So then going to legal services. This is always one that is so important. So free legal advice and services to older Chicagoans who are age 60 and over. So the one thing we don't do is civil cases. But what they will do, they will help to prepare your powers of attorney for healthcare, finance. They can help you do a living will, you know, with financial issues, including bankruptcy, landlord and tenant issues. There's a huge influx, as you might imagine, as the housing moratorium has been lifted, with people facing eviction, foreclosure, taxes, immigration, consumer debt. Sometimes people have mental health conditions that cause them to go tremendously into debt. They can help to navigate this. It's free. It is a phone call away. And our provider for that is Legal Aid Chicago, and they're just fantastic. And Lucas and the team here, if you're interested in a talk about legal services that are available, I'm very happy to connect you to someone to speak to you about that. And then finally, we also have adult protective services. And adult protective services, of course, this is another lifespan program. So 19 and older, what they do is they investigate abuse, neglect, and or financial exploitation of people 60 and older or 18 to 59 with disabilities. So this is the adult version of child protective services. And this can be something like self-neglect, like I'm so depressed, or my health is so bad, or I've never taken very good care of myself. And now that I have health conditions, I'm really not doing a good job. So we would call that self-neglect. What if you think someone's at risk, they're being taken advantage of? If you hear someone who says, my niece came and stole some of my jewelry, my next door neighbor is bullying me, you can call us and we will help to put a report into Adult Protective Services. We oversee 4 agencies across the Chicago area, again, regional, and they go out and represent people to make sure that their rights are adhered to and that they have a voice, because as we know, sometimes, not all the time, thank goodness, but sometimes people feel like they have less rights as they grow older, or they feel like they can't use their voice. Or, for example, if someone is a victim of financial abuse and someone called and said, you know, if you send me $20,000, I'm going to send you $200,000. They might not want to tell their family or caregivers, but we can connect them with Adult Protective Services and they can represent them. So let's see the next slide. Okay. And this is our last slide. So I know we just have 15 minutes left. What's happening beyond this year and today? Well, we have been the recipient of a generous award that older Americans really received a nice amount of funding through the American Rescue Plan, ARP or ARPA, sometimes you hear it called. And this was the Biden plan that came out in March. And we have a variety of expansions of our existing programs. And we have new programs that are being started. Some of our programs are listed here. So we have one particular initiative, which has been around vaccination support and helping people to address vaccine hesitancy. And as you can see here in FY21, we reached over 50,000 people with that. And we actually work to connect folks with their vaccination appointments, their boosters, and really help them to get services where they want and how they choose. And talk to them about some of the issues that folks have when they're worried about taking the vaccines for COVID. We're working to expand our home delivered meals and nutrition programs with more culturally sensitive menus and culturally competent that reflect some of the diverse meal choices and groups that we have across Chicago. We've been tasting some of the new meals recently. They're really, really looking good. I think I had Indian food last. And again, that's an expansion of the existing foods that we have. We really continue, we know that social isolation, we've always known people are socially isolated across the lifespan, but of course, during COVID, and in particular, older adults really became even more socially isolated. And so we have new programming that will help to mitigate the negative health effects and really work to prolong independence. And we're going to have a program called Aging Well Navigators, where we'll have teams that will go on site to buildings that have high concentrations of older adults and actually bring the services, bring the folks to the buildings so they can connect people to services on site, and then help to reduce any resistance or reluctance or inability to get out of the house so that folks can connect. It's going to be a really exciting program. And then, of course, we have continued safety and prevention measures for COVID-19 and flu, of course. So we have the city's vaccination at home program, where you don't even have to leave your house to get a vaccination or a booster. We have clinics at our senior centers, and that's both flu and COVID, as well as boosters. So these are some of the, only a few of the many exciting programs that'll be happening. And if any of you all, of course, you have our phone number, 773, I'm not going to be able to, 7444016. Did I get it, Stacy?
312. It's 312. I'll put it in the chat.
So yeah, Stacy put it in the chat. That's awesome. You can also email us at aging@cityofchicago.org. And of course, we are on social media as well. So if you like Twitter or Instagram or Facebook, you certainly can follow us there. I think that's all I've got. Stacy, did you want to add anything?
No, I think we covered it. I mean, we can take this time. I know we only have about 10 minutes left, but we're happy to answer questions. I did see some in the chat.
And this is Barbara. I just want to clarify. We will be staying open after 1, the Zoom. But if you guys need to leave at 1, yeah, that's fine. So we'll take questions as long as you, Stacy and Karen, as long as you have time.
Okay. And do you have, are you all planning to field the questions, or would you like us to
go ahead. Since you've been following them in the chat, why don't you go ahead and start addressing?
Yeah, I can start reading it, and then we can.
Yep.
Okay. So someone was asking, Jenny was asking, can you assist in how to find resources or start a search about senior housing, not nursing homes, but more so independent living?
Right. So great question. And you can call INA about that, Jenny. You also can, so it depends on kind of what you're looking at. And so someone would talk to you and say, well, are you interested in housing that is for only older adults? Or are you interested in buying or renting? What do you foresee happening? Will you stay in Chicago? Will you move outside of Chicago? So some of it is just actually a conversation about what are you needing. There certainly are a number of Chicago Housing Authority buildings that are particularly designed for older adults, but it's a conversation. So we certainly can support you with resources and have that discussion about what are you individually looking for, because it just varies for everyone based on what they want. So I would encourage you, Jenny, to start with thinking about what is important to you with where you live, because making sure that you find a setting that supports you with some of those important things is a good place to start, if that makes sense.
Okay. Question about home delivered meals and if it's the same as Meals on Wheels.
Stacy, go ahead. You've got that one.
Yep. So yes, people use those terms interchangeably. When we say Meals on Wheels and you're thinking of the meal that's delivered to your home, the hot food, the cold and the frozen that we mentioned. Now there is an official Meals on Wheels organization, but I don't know, Karen, if you want to add to that a little bit or.
Well, there, of course, is a nationwide program, and they may even be international. For all I know, the need for food and the issue of food insecurity so pervasive. Our home delivered meals program includes, so we have meals that are delivered to your house. They can be hot, they can be frozen, they can be delivered anywhere from 3 to 5 times a week, if I'm not mistaken. We also have just our congregate dining, which nobody ever uses that word. So it's dining together is what I think of it as. And that was where people would come to the senior center, or we have 29 other sites throughout the city. Some of them are in CHA buildings, some of them are just at community outlets, some are affiliated with faith-based organizations where you can go and have a meal with other people. However, during COVID, they've been offering meals to go, of course, because it has not been okay to eat together. So we have a broad definition of meals. We have some really exciting new programs that will be coming with our American Rescue Plan dollars, and also have some new food resources as well. So.
Yep. The question about slides and if they're going to be available for download. So we can certainly send the slides over to Barbara. If you want to coordinate sending that out to the group, we'll be happy to share.
Thank you.
Okay, there's a question, and I think you might have touched on this. So how can Hyde Park Village offer help to homeless in the community? Recently, they had a homeless individual that froze to death. Churches and individuals offered help over the years, but it seems to be an intractable problem as most shelters are temporary.
A huge problem. And as we know, it's growing nationwide and worldwide. I'm sure all of you see, I know in where I live, I see more tents around, I see more people under underpasses, and it's troubling. And to hear that someone froze to death, it's horrific to imagine that we live in this day and age and things like that can still happen. I think that, providing service to your community is wonderful. Sometimes churches and other community-based organizations have a strong local presence. We also, of course, have our homeless services here, and we certainly can connect you with our peers in homeless services to see if they can match you with some organizations or delegate agencies that are serving individuals in the Chicago Hyde Park service area. And I just want to say, Catherine, thank you for your compassion and concern. This is a really important issue. And, just to let you know, in the world of aging, we have been concerned about seniors or older adults becoming homeless and the increased issues around people with housing insecurity or at risk of homelessness. Because what we know is that while there might be this idea that older people have all this money and pensions and resources, and yes, it might be true that many do, it's also very true that they have spent their lives helping their families, and many have limited resources. And so the risk of homelessness is closer than you might think. And so I applaud your interest in this area, and you all keep us apprised and let us know what you're seeing in the community. We do get some calls to 311, and of course you can call 311 for any issue in your community, but we often get calls about folks that are people have concerns about. They might be in a bus shelter, they may be living under an underpass. They'll let us know, and what happens is we send a team out there to go and visit with them and try to match them with a shelter, which is of course temporary, but at least it's a step to getting some supports to them. And just for your information, in Chicago, we do not have a senior specific shelter. That is a dream of ours. So if you know someone with many millions of dollars, know that this is a need.
I do want to add too, as well, to promote one of our city's program, the Emergency Rental Assistance Program. And so, if there are individuals who might be at risk of homelessness, I'll put the link in the chat. This is from another another division, but they do help with that, and I think they are accepting applications. So I'll add that on there as well.
Thank you.
Okay, someone said, great services. How do you promote awareness of your services?
Stacey, you want to go ahead?
Sure. So yeah, community events like these, you know, thank you again to Chicago Hyde Park Village for inviting us to come speak. You know, we've presented to other departments, like I know that some of the police departments reached out, and we've presented at like those the CAPS meetings. You know, other departments such as the animal welfare, which we did recently. We also work with our community care organizations and the managed care organizations. You know, they are the eyes and ears in the community. And so, you know, seeing clients in their home and sharing what services are available, as well as through our senior centers. You know, we've been able to promote some of our programs there as well. But certainly if you all have suggestions, other organizations that you're part of that you'd like us to come speak with, we're happy to do so. You know, and share some of the services that can be available. Okay, someone asked, other than PACE, what are transportation options for trips to a medical appointment? I know that Hyde Park Village has this service also.
Stacey, this was about transportation, right?
Yes.
I don't know if you all are using anything like Uber or what's the other one? Lyft, L-Y-F-T.
Yeah.
Thank you. I want to let you know there's a program that you might want to look up. It's called Go Grandparent. And maybe we can put it in the chat, Stacey, if you can just put it in there and put their website. What Go Grandparent does is it has connections to both those programs, but there's a real person who answers the phone. And so they have, you give them their information, and it's probably one of the worst names I've ever heard, but whatever. They're offering real-time support for people who want to talk to someone on the phone or maybe don't have a smartphone. And so that is something that I have seen a lot of older people be very pleased with. I know at one point the drivers who were being used also had to go through some training about how to work with older adults. And so that's something that I have seen folks use because it's certainly less expensive than taxis or other options. So again, that's Go Grandparent.
So those look like all the questions in the chat. Do folks have any other questions? We might be able to answer one or two more.
I had a couple of questions. One is, it sounds like earlier you said if you have someone wanted to know about options for community living as we age, and you said you could call and talk to someone at DFSS Senior Services Division. I'm wondering if that's a place, if people have, there's a lot of questions that come up about issues as we age. Is that an option then to say, I have this question and call you guys, and at least you would help them think through where they might turn for more information if you don't have that information? Does that question make sense? I mean, it's because this is so new to folks, to many folks, that they don't even know who to turn to ask for additional information. And, you know, we have various skills in terms of surfing the net to find out the information that we need. So Stacey and or Karen, what are your thoughts about that?
Yeah, I mean, you can certainly contact the information and assistance line. We can also put our emails in the chat as well. You know, and if it's something that we don't offer, you know, we can always refer to other resources in the community that could address that. You know, so yeah, I mean, certainly don't hesitate to reach out if it's something that we're able to assist with. You know, we'll either, you know, connect you to one of our services or hope to refer to an appropriate resource.
And we went to some programs at the Cook County Elder Justice Center long before the pandemic shut down. But you're saying the city of Chicago also has legal services for seniors. That would be in addition to the Cook County Elder Justice Center?
Yes, it actually is quite separate. It's completely separate from the Cook County Elder Justice Center. While the Elder Justice Center may work on having a location where people can go to court and have their cases directly heard and receive assistance, this is one-on-one legal assistance to talk with you and work with you. And it can be just a consultation, as simple as you giving them a call and then providing some guidance to you to actually working on a case for you.
And I do see that we're at 102, and I apologize. We do have another meeting that we have to attend, but I really want to thank you for, again, inviting us to come speak with your group today. We'll be happy to share the slides, and please, feel free to reach out to us if you have any additional questions.
Thank you, Stacy and Karen. It was very helpful. We appreciate
Thank
being able
you.
to report it, and we appreciate you sharing your slides. Have a good afternoon. And the program, the Zoom will stay open for people that want to chat. Thanks again, Stacy and Karen.
My pleasure, absolutely. Thank you for having us. Please don't hesitate to reach out. Both Stacy's and my contact information is in the chat. Have a great day, everyone. Take good care.
Bye now.
Bye-bye.